Well, hello, world. I'm Dr. Kimberly Ku, and welcome to Val-You Based Care. This is a podcast that I've been wanting to do for a while now, especially with being in practice for 6 years and learning how there's so much insight to be had that's even beyond our training. We learn a lot in medical school. We get multiple board certifications. We have a lot of the hard sciences. We learn the technical language. But I really wanted to take some reflective time to explore empathetic communications and how really that is a hard science too when it comes to healthcare. When it comes to taking care of someone, I think being able to have evidence base and quantifiable data when it comes to communications, even more so now than ever, I think that's an important field to emphasize, especially with so many changes, so much uncertainty in the future with AI, social media, technology, and thinking about patient outcomes. I'd really love to be able to link empathetic communications to better patient outcomes that we can measure. I'd really like to address our concerns as providers of upcoming provider shortages. So, how are we going to be resilient in burnout by having skills that help protect our relationships with our patients and the fulfillment with our work? And I also think of even just as healthcare as a real world business. I actually think empathetic communications, once we focus on the evidence base and the quantification, that we could even think about the economics or the return on investment of empathy and communication and really think about it as something that's actionable, results driven, something that we can measure and that therefore we can focus on and improve upon. I think there's actually a way to be able to show such a thing as an empathy CV or an empathy resume. And a lot of that is part of what I want to build is the evidence base, it's the research, it's the stories, it's the training, the interaction for all of us to get together and really think about how if we can't really measure something, it's hard to actually improve upon it. So let's start to learn, how do we measure excellent communication? How do we feel really confident about the quantification of our empathy? These are things that you're not going to see when you go online. But now I'm doing this podcast and I'm hoping to find all of the types of folks who are excited about this idea of showing how we need to be paying attention to communications and empathy at the medical school level as much as anatomy or biochemistry. It's that important, if not even more important nowadays, where we're looking for that distinguishing factor about who it is and why it is that they're going to be my caretaker. And a lot of my approach and my thought process comes from the experience I have in community practice, where I'm driving to multiple sites and accommodating multiple community cultures. Also, working with lots of different stakeholders, like being a partner to academic centers, being part of large cooperative research studies, and just in general, wanting to always learn what it's like for someone else existing in the community. A lot of that is not really part of medical education. We learn that, or at least I certainly have learned that through my own experiences in practice. And I think having a little more of that education earlier, especially formalized in the medical world, would be so much of a time saver. I think about it would have helped me immensely, especially even a lot of ways get myself out of my own way to help people better. Yeah, so community oncology is something that actually when I joined community practice, I had my own idea about what it meant. To me, it was very uh very mechanical. Like you go and drive to a community, you service that community, and it seemed very simple like that. But over time I actually appreciated the evolution from the way that patients related to me, and they were giving me all sorts of feedback about what they felt like was making them feel that they could build rapport with me and build trust and really feel like I was doing even more than just taking care of them as a doctor, but I was really a person that really just cared about them. And I think feeling like I was giving that contribution that's a little bit extra, like that little bit of that feeling of they come here and they're safe and they're calm. And I didn't really think of it like I was selling some sort of medical care. I wasn't thinking about it like I was trying to do some sort of skill or use some sort of knowledge. It was just being myself, really. And patients telling me, actively giving me that feedback, and even talking amongst themselves and with other providers of giving me that reputation as someone who they could feel like they could communicate with and not just have it be dry facts, but it could be fun, it could be deep, it could be really feeling like a partnership, like they have a say in it. To me, community care is something that I think a lot of providers really want, but as we go through training, because the training is so detached from communication and empathy, what we consider soft skills, and we pride ourselves on hard skills, then we start to forget that that's actually what's so fulfilling about the patient relationship. And then we have to fight some of the external pressures like time and some of those business aspects. And I look at it like being able to even go back a little bit into training and remember what it was like being a trainee and trying to honor that by now bringing this education as someone who's been in practice, but now trying to reach out to academic centers and help with that education process. I feel like community has so many layers. There's the community I take care of, that person in front of me, the place I go to, the multiple places I go to, all the partnerships I have. And even now with this podcast, I feel like this is its own community that I was actually on multiple accounts asked to come out of sort of that medical shell and start speaking about what is this feeling, this vision, this contribution, this growth that's even beyond medicine, almost feels a little bit spiritual. So that's why for me, I feel community is so important and everyone's got their own definition. And in healthcare, we really want to give that space to explore what does that mean to everybody. And I want to have this podcast be that safe space. I really want to be able to share this future podcast as a form of collaboration, of partnership. Anyone who's interested in understanding more about what community oncology means, and also wanting to share my own personal story. I think a lot of healthcare providers go into medicine having that, once upon a time when I was a little child type of story. And I'm not unique in that I also had a time where when before I was a doctor, I had a friend in college and he died of cancer at a very young age. And that informed a lot of the questions that I have about what does it really mean to take care of someone, even beyond the technical and all of the training, the medical information. What does it actually mean to really understand what someone else is going through and to articulate and show to them that you understand? And then that way, together, be able to take action that's helpful for everybody. Well, thank you everyone for joining today on my very first episode. Please hit the subscribe button on whichever platform you're using, and excited to see you next time.